Welcome to Plastic Surgery TNA. I am Dr. Earl Stephenson Jr., board certified plastic surgeon here in Atlanta, Georgia. Today, we're going to talk about muscle repair. Does a tummy tuck fix muscle repair? Can we fix a hernia? What is a hernia? If you're interested in this episode's for you.
Welcome to Plastic Surgery TNA. Talk and advice with Dr. Earl Stephenson, board certified plastic surgeon and facial aesthetic expert. Real talk, real results, real transformations. Let's dive in.
Okay, welcome back to Plastic Surgery TNA. I'm Earl Stephenson Jr., board certified plastic surgeon, and today let's talk about muscle repair. We're going to talk about Diastasis Recti. That's the fancy word for muscle separation. It's Latin for stretching a thinning of the linea alba, which in Latin also means white line. So muscles are kind of red, beefy structures. They are covered by kind of a whitish covering. This covering connects different muscle groups one to another. In the center part of your tummy, between your six-pack muscles, you have the structure, the linea alba. This structure is stretched. It's typically stretched by either pregnancy, weight fluctuations, or increased tummy pressure or abdominal pressure. That can be due to weight of fat around the organs, chronic straining from constipation. Those things are less likely, but weight and pregnancy definitely can stretch that structure in the middle, and that creates a separation, not really a hole, but a weakening or stretching of the two six-pack muscles or the area between the two. Symptoms are kind of a mild bulge, especially when you're trying to sit up. Some people will say you can have associated back pain, feeling that your core is weak. You can have posture changes and difficulty with high tension movements, like maybe doing sit-ups. Myth that the muscles are ripped is actually a myth. The muscles are not torn. They're not truly separated. It's just that the covering has gotten kind of loose or lax between the two muscles. Diagnosis is really just kind of by examination. You really don't need any type of x-ray. So a tummy tuck can readily address this. The standard tummy tuck takes care of skin, fat, and that weakness or laxity of the fascia, the covering of the muscle, to give you a more contoured core. The term that we use in plastic surgery to tighten the muscle is called a rectus plication. That means we take stitches basically from the breastbone to the pubic bone and corset or quilt that loose segment closer together. Again, bringing those six-pack muscles toward the center, reducing that weakness or bulge. And we do this as a double layer. So we'll do it once. Once we've done that layer of stitches, then we come back and do it twice, covering that first layer. So typically it's a double layer of stitches, and typically the stitches are permanent. Now, having permanent stitches does not cause any harm internally. The body will scar this and kind of reinforce that tightening by putting scar tissue around it that's less stretchy, less pliable. You can safely add liposuction to a muscle repair and removal of skin to improve the contour, so that does not impact the muscle repair. What you can expect is a more contoured abdomen, an improved core because it's not as weak or stretched out, but it does not give you a flat. And a lot of clients want a flat tummy. You are not an inanimate object. You're not a wall. Muscle, fascia, skin is dynamic. It's soft. It moves. We improve the contour, but we don't make you flat. As a caveat, below the muscle, You can have fat around the organs internally that give you still a bulge even after muscle repair. Visceral fat, which is what I'm referring to, can only be changed by you. So no matter what technique you use and how tight you make it, if you have visceral fat, then that's still going to give you some roundness to your tummy. So again, you need to address that through diet and exercise, but as plastic surgeons, we can tighten the muscle through a rectus plication. After this is done, we want to protect that. We want you ultimately to have core strength, but we need to protect that. And there are a couple of phases of the healing process where we kind of increase your activity so that we can protect the repair, protect the improved core stability. So in the first phase, called the early phase, this is usually 1 to 6 weeks. Again, we protect it. You're able to obviously walk. You're able to definitely breathe and take deep breaths. We offer lymphatic support during that time, either through lymphatic massages. Good nutrition is important to help repair and strengthen our repair. We want to avoid any excessive strain. So we typically give you stool softeners so that when you have to use the restroom, we don't have increased pressure by straining to have a bowel movement. So we make sure that that process is a little smoother for you. In the intermediate phase, weeks 6 to 12, we kind of guide your physical activity or physical therapy. It can be really basically a structured home program. You can do deep diaphragmatic breathing that kind of expands the core, but again, because we protected it in the first 6 weeks, it won't rip or open up or damage the repair. We also kind of show you how to activate your what we call transversus abdominal muscles. That's beneath the rectus or six-pack muscles. We give you exercise to show you how to activate those muscles to strengthen them. We reinforce pelvic floor exercises to strengthen the bottom of the core, because this is a core. It's a cylinder all the way around, with the top being the diaphragm and the bottom being the floor or the floor of the pelvis. So we show you how to strengthen the floor so that we don't have abnormal pressure that builds in the front that pushes or potentially damage or weakens our repair. In the late phases, which is usually 3 to 6 months, we can add more strenuous core exercise such as planks, progressive carrying of loads. But your surgeon, your plastic surgeon, may have you avoid aggressive activities such as sit-ups until you have demonstrated, probably by physical examination, that you can progress to that point. So that's a bit nuanced, and it's up to your individual plastic surgeon. The outcomes from this are really kind of better trunk stability. You feel confident in the core. You have improved posture. Again, if you have some back pain, you can have lessened back pain. Repairing the muscle. I want everybody to hear this. Repairing the muscle through a tummy tuck with muscle plication is not a treatment for back pain, and it's not indicated as a medical necessary procedure. It's not one of medical necessity. It gives you more confidence. It gives you better contour. It has a benefit of improved core and maybe improving some of your back pain symptoms, but there can be other causes of your back pain. So there's really no shortcuts. You got to train these muscles once they're back in position and help you look better, feel better. Some red flags that you may have some trouble with the muscle repair is that you do have a sudden bulge after repair. You do have sharp pain. You may even have fever or even drainage. If you have any of those symptoms, you definitely need to call your plastic surgeon. A lot of times when we have tummy tucks and people have kind of this rectus diastasis, this weakening, there can be hernias that you can feel before surgery, at the evaluation, at the consultation, and you need to kind of plan for that. Sometimes it's a surprise. Sometimes you have small hernias once you've kind of lifted up the skin and you're ready to tighten the muscle, then you discover a hernia. If a hernia is small, it's at the base of your belly button, or it's just above or below, then it can typically be fixed by placing a couple of extra stitches to repair a hernia. And a hernia actually is a hole in the wall of the tummy where the fat around the organs and or the organs themselves, such as the intestines, can poke through. So we want to reestablish that integrity to keep the organs separated from the skin surface or the fat just below the skin. So a couple of stitches in a small belly button hernia or small hernia above or below can help repair that, and then follow that by the 2-layer muscle tightening. Occasionally, these hernias can be complex, and if they are complex, they're definitely something that is diagnosed prior to a tummy tuck. I often feel in my practice, if you have a complex hernia, a large hernia, then providing a tummy tuck procedure during that repair is not the best time for it, because often during that repair, our general surgery colleagues, who are the best suited to treat these, will strip away the blood supply to the belly button, which can jeopardize it or cause it to die. They will add certain things like mesh reinforcement, kind of like screen doors, once they've kind of repaired the larger hernias, reduced or replaced the abdominal contents back into the abdomen, tighten or stitch the muscle together because there was a hole, and then reinforce on top of that with a mesh like a screen door. That's really not a great time to have a tummy tuck, lifting up a lot of skin, stripping away the circulation, which can jeopardize healing, especially in the presence of a mesh. A mesh is an artificial substance. The body will incorporate that if the circulation to the area is good or robust. If we lift the tummy up and try to do liposuction, we further, as plastic surgeons, remove or reduce that circulation, which can cause failure of the mesh and failure ultimately of the hernia repair. So large hernias, complex hernias, in my opinion, do not marry well with tummy tucks. A lot of clients want to try to get those two things done for many reasons. One being recovery, maybe their insurance will cover it, which they won't cover the tummy tuck. And from our standpoint, we need to protect the patient from those misconceptions and stepping back and saying, no, this is time for your general surgeon to step forward. Next, if we do a tummy tuck, we do a standard muscle repair, maybe we even repair a small belly button hernia. Drains and prevention of seroma is important. I have a whole video on that, and please check that out in this podcast series. But a seroma adds risk by presenting a fluid collection that can easily get infected. This can be kind of mitigated or minimized by placing drains. Drains are important. I like drains. There's a technique called a drainless tummy tuck, which uses progressive tension sutures, which does not require a drain. Again, I'm not brave enough to perform a tummy tuck where I lift up the skin and I tighten the muscle and I do liposuction. I know that the body's can produce this normal healing fluid, and the body can't soak it back up efficiently, and I don't give it another way to do so. That's what a drain does. That's what progressive tension sutures do. But just doing progressive tension sutures or a drainless tummy tuck alone really puts a lot of confidence that the body can efficiently 100% with 100% efficiency reduce or resorb or absorb this fluid. So I typically put in a drain, and if I use progressive tension sutures, I still put in a drain. It's just belts and suspenders. I add compression by putting in clients in compression garments. We want to make sure that clients are moving around, have great hydration, and are not on nicotine, so that we can then, reduce the likelihood of having poor outcomes from poor blood supply. Nicotine reduces the blood supply, increases inflammation because there's a lack of blood supply, and potentially cause problems. So Seromas we drain. We don't add nicotine to minimize our repair, minimize our outcome. And we want to make sure that clients are medically optimized as well. We want to make sure that people are appropriate BMI. Every surgeon has their BMI cutoff. I like to have a BMI or a body mass index of 34 or less. I like to have people who do have diabetes and are followed by hemoglobin A1C, which is a blood test that follows how well your blood sugar has been controlled over the previous 3 months. I like to make sure that that is under 6, preferably under 5. Again, if you have multiple medical problems, if you have a high BMI, you have diabetes, you have high blood pressure, you have asthma, you may not be a great candidate now. You may be a great candidate in the future, or you may never be a great candidate. But if you do have diabetes, as an example, we want to make sure that that's well optimized. If you are someone who has had a history of weight loss and weight gain, we want to make sure your weight is stable and that your BMI, in my hands, is at least under 34. Every surgeon is different. So we need to make sure that we have the safety guards, that when we repair our muscle, repair hernia, that we do the things to make sure that that repair stands the test of time. Progressive core stability with home exercises and progressing to more aggressive exercises over a period of 6 months. At the time of surgery, reducing the chance of any circulation problems by not having any nicotine on board, vaping, smoking, patches, none of that. We want to make sure that we either use drains underneath the skin to drain any healing fluid that is going to occur, or we use drains and progressive tension sutures. I am not a fan, or I'm not brave enough, I'll put it that way, to use progressive tension sutures only as a drainless tummy technique. Some surgeons do with great efficiency. Again, that's just not something I'm comfortable with, and I won't put you in jeopardy for that or with that technique. So, last but not least, let's talk a little bit about fact and fiction. So, let's go. So, tummy tuck is not a weight loss strategy. True or false? Fact or myth? That is a fact. Tummy tuck is not a weight loss procedure. So if you are struggling with weight, removing the excess skin, the muffin top, that's not the right procedure for you. You need to have nutritional support. You need to be evaluated by your primary care physician. And if you have significant weight to be lost, then you might want to consider consulting with a weight loss specialist that can either offer more intensive medical therapy or even offer or recommend surgical therapy. So tummy tuck is not a weight loss strategy. Number 2, you will never need physical therapy after a tummy tuck. That's false. Good rehab equals good results. And I don't mean you go to physical therapy like at one of the centers, freestanding centers. We make sure that we help you strengthen your core for at least activities of normal daily living. And if you are someone who is interested in exercise or has exercised before, make sure that you get back to your pre-surgical strength after your improved contour with, again, progressive home exercises, follow up from day 1 to 6 months to beyond. So that's number 2. Diastasis is the same as a hernia. True or false? Myth or fact? That is a myth. A diastasis is a stretching of the covering of the muscle. There is no hole in the wall of the tummy. A hernia is actually a weakness that has produced a wall, a defect, or a hole where the contents of your abdomen, i.e., the fat that's around your organs, and more specifically your intestines, can poke through. And you're probably saying, well, what's the big deal? Well, if that keeps poking through, one day that knuckle of intestine may get swollen and it may get stuck and it can't get back down. And when it's stuck, it can get strangulated. And when it's strangulated, it loses its circulation. And when it loses its circulation, that part of your intestine can die. And it can make you what I used to call 4+ sick. That means you're in the hospital. You may be in the ICU. There may be, if it's not caught in time or the right things aren't done, it may threaten your life. So again, hernias, no matter how small or how large, can be a threat and they need to be addressed. A lot of times, if they're small, they can be addressed at the time of a tummy tuck, either if they're known beforehand or found incidentally. If they're large and complex, then it is my recommendation, and every plastic surgeon is different, that be broken up. You need to get that fixed by your general surgery team, heal for at least 6 months, maybe even a year, come back, be reassessed by someone like myself, a plastic surgeon, and then determine if you're a good candidate for a tummy tuck at that point and how best to move forward. Last of the lightning round, all hernias need mesh. True or false? Myth or fact? Myth. The size of the hernia really matters. The quality of the tissue surrounding the hernia really matters. If it's small, you can repair that with a couple stitches. If it's moderate size, but you try to put a stitch in and the tissue quality is poor and it just rips, you may need a mesh. If it's large, you definitely may need a mesh to reinforce that. So size of the hernia and quality of the tissue do matter. So this was a very quick podcast. It's the holiday weekend. It's Labor Day. So, I'm closing up shop for the weekend. So I hope you enjoyed this. I wanted to present something new over the holiday. We'll get right back into it next week on this podcast that happens every Saturday. Usually we air and videos are posted anytime after 11 a.m. Saturday Eastern Standard Time. I hope you guys have a safe holiday weekend. If you like what you've seen, please like and subscribe. I know you hear that from a billion different podcasters, but it really helped me. I don't get any money from this, but it helps my channel become more prevalent. It helps the algorithm spit me out in front of people who may want to hear this information, may need to hear this information, may need to hear it so they can share it with someone who they know needs the information. So again, it really helps me to be front and center in the algorithm so that my message can get out to help people make the right decision and safe decisions when they're considering plastic surgery. Again, if you want to work specifically with me, I champion that. It's really simple. You just do a couple of things. All you have to do is really call my office. And my office number is right here on the screen. I put this up on every episode. It is 770-466-4700. We'd be happy to schedule a consultation with you. The consultation is $250. I try to be transparent with pricing so that you can decide right now if that's worth it in your mind. But the value you get for the $250 is that you spend at least an hour with me. You get unfettered access to me. And we make sure that we go down all your expectations. And then I try to marry a plan that can meet those expectations as best as I can provide. Sometimes there isn't a plan. Sometimes there isn't a really good plan for you. And so if that's the case, I will let you know, or that you don't need that, or that a liposuction case or surgery may not give you the results that you're looking for. But so this is a good way for us to talk about your expectations. I can tell you what's available and what's safe, and if we can meet those expectations. And if you decide to move forward and we do develop a plan that makes sense, then that $225 is a credit toward your pending surgical procedure. So with that being said, again, thank you so much for all of those of you who have tuned in over this last couple of years. The channel is really growing. We've gotten up to a couple hundred followers now. We started in the 30s. So I really appreciate for those of you who've been watching and sharing. Again, if this is new to you, please hit that bell icon so that every time there's a new video, you'll be notified. So on that point, please be safe wherever you are in the world, and be healthy, wealthy, and wise. Until next time, peace.